quick intro from your side. We heard, where you come from, but just explain a little bit. But Techniker, Krankenkasse, I think, is known, but Qunomedical and also Vadym, you just arrived from Kiev with a product that is probably not so well known in Germany. If you just quickly explain exactly what you do to make it easier for the audience to understand where you come from and what's your background.
About Qunomedical. Qunomedical is an online platform that is basically giving patients the instant access worldwide to high-quality healthcare for an affordable price. So we give patients the option to browse around on the website, identify their doctor, their hospital, compare prices, compare packages, and we basically do the legwork for him. And so he can receive a free quote within 24 hours and book his treatment right away. Myself, basically I have a legal background, so no data science background, but legal and economics. And I'm basically responsible for setting up the partnerships, hospital partnerships, strategic partnerships, maybe with insurances. And and that's kind of what I'm doing.
Vadym, you just arrived from Kiev.
I am Vadym. I'm Chief Technology Officer of Solve.Care Foundation, and currently we are building a massive healthcare platform on blockchain, which is primarily focused on care coordination, care delivery, and benefits administration. So we connect in all the stakeholders of these business processes all together, and also empowering actually patients to be in charge of controlling their data. About myself, for almost a decade, I was involved into building health insurance exchanges all over the United States, and in particular, we were implementing Obamacare program in several states in the United States. That's it.
So Torsten, you're the one with the insurance background. You're talking about insurance. It's great to have you on the panel because as an expert.
Okay, my name is Torsten Hecke. I'm working for Techniker Krankenkasse, which is the biggest health fund in Germany. We are covering about a little bit more than 10 million people. And I'm heading a unit that is named Analytics and Insights. So my team is about 20 heads. We're doing really sophisticated analytics to produce information that were not been in our company before, to produce new products, to review our processes. And we are using all data we have from our injuries. So just to give you an idea with what we deal, we have about 10 billion observations in our hands, so that we can use for different questions concerning healthcare in our population.
So how does such a user case look like? We have all the data. How do you structure? How do you analyze? And what do you do at the end with the data? That's what a lot of patients are also worried about when the data just go from A to B. What happened at the end?
Okay, the problem is maybe not to ask what do we do with the data. I think it's my micro that makes a funny noise. Okay, the question is not what to do with data. The question is what to do with the insights we generate. Maybe you know that in the German healthcare system, the health funds or sickness funds are the only ones who can collect data from all sectors, so from hospital, from physician sectors, and so on. And we are combining this data from different sources, looking for information that had not been there before. So, for example, we are looking for patients with chronic diseases, so with long-time diseases, how they go through the system. Are there breaks between different stages? Are there special informations about hospitals, whatever, so that we can then take a look to these new informations and build new products upon this information. Another big field we are in is fraud detection and fraud description. We are building a lot of models to to detect fraud, to predict hospital stays in the next period, and so on. So it's a really huge field we are working in.
You were both nodding, and I know you, Vadym, are also in the care coordination and benefit coordination, and
Yep.
you know, fraud and blockchain and trust and transparency, big topics nowadays.
Yeah, that's true. Actually, fraud is a massive topic, and it's actually one of the key drivers why you need transparency and immutability to have in your system when you're trying to coordinate fraud and benefit administration. Blockchains allows to do that partially, and blockchain is not a solution for everything. But having accessible data, as Torben just mentioned, actually, to be able not only to detect fraud, but also to predict and to prevent these useful insights of what you can get, of analyzing data in multiple dimensions. And healthcare by itself is a massive area, and healthcare data is a multidimensional data. And it includes clinical data, financial, behavioral, demographic, and so on and so forth. And you can do interesting discoveries in each of those dimensions.
And when we talked before, and you also said it's not that blockchain was there and you thought there's a user case in healthcare, but your background is actually 10 years healthcare, and blockchain came along, and it's now a solution that might be beneficial for a problem that existed beforehand.
Problem exists for too long. It's not a new problem. You're absolutely right. Blockchain allows solve it partially, and you cannot put all the data on blockchain. It sounds really cool, but there is no sense in making that. What you can put there is anonymized data, depersonalized data, probably some kind of financial data, but definitely not a clinical records or some treatment details.
It will be fun because we have some talks afterwards on blockchain and healthcare. So let's see what they also described in user cases. You Christoph, are just saying best value for money. So if there's not a good solution in Germany, you have 100 hospitals or even more, also trusted ones, and you recommend that to people that don't find the treatment or the healthcare plan they're looking for in their home country, and they say, you know, try your luck in a different country. So the data that is also beneficial for insurance companies might come from the Philippines.
Absolutely. However, we do it a bit differently. We put the patient kind of first, so we really try to be really close to the patient journey, and that's also data that we would say we can provide, and therefore, if you consider, for just as an example, like a patient journey, someone who is going abroad for a treatment, let's say hip replacement, and what we do is basically we collect these patient-reported outcomes before, during, and after the treatment. That means we can see correlations for patients that have a higher a higher pain sensitivity. So we basically correlate, and we can see, oh yeah, we had XYZ patients going to that doctor in Budapest, and there we see these patients basically all reported, although the doctor is great, they felt a bit more pain. So we do see a difference why people go to this hospital, why people go to that hospital. And this is kind of what we do, besides all the objective data and all the data that we can collect from hospitals and from the operational excellence that we see within our partnership with the hospital.
But where did you get the data from?
From, you mean the patient data?
Yeah.
So basically we have an automation process in place on from several surveys up to basically close reports that we receive from the patients during the whole cycles of treatment. And just as an example, you maybe know the NPS score on basically how far a patient or someone would recommend a hospital, or in this case Qunomedical, to some friends and family. And we currently have an NPS score of around 82. And we do that for every hospital and for every doctor. So this gives us the information that we need in order to present these to patients so they can do the decision of saying, this is the doctor I want to go for.
Torsten, when you ask about where does the data come from, when we talked before the talk, you said the data quality is still an issue. So you have all that data. How good is the data you have?
There's the saying, like, shit in, shit out. Sorry, my French, pardon my French, but this is like this is also what we see, and this is, I think, still one of the biggest challenges in healthcare industry to overcome and to see what is the data that we can collect and what we get, and how good is the quality actually. And yeah, I agree there.
I think it's a really big issue because in healthcare, data are emerging because people going to doctor, to hospital, going to pharmacy for drugs and so on. So at every on this point, data are emerging in the system. And these data are normally emerging because somebody wants to have money. The hospital will be paid, the drugs have to be paid, and so on. So these data are not there for describing morbidity or service level or whatever. They are there for simple claims management. So that means, in fact, we are using these data as a form of secondary data. So not in the sense they were originally developed. And we always have this to keep in mind, because it's very important to recognize if you interpret this data. These data are not made for analytics like we do it, or you. So that's they're made for doctors and hospitals and so on.
So there are a few data scientists here in the audience that actually want to know, how do you do it? Like, what's the profile of a person that is doing it? How do you get the insights at the end? Because it's also a question, how do you structure it? What are the algorithms you're using? What is the team like that is working with that kind of data? That might be also interesting.
Shall I start?
Yeah.
Okay. In my team, we have, I told you it's about 20 persons. It's about 6 doctors and pharmacists, and the rest are mathematics, meteorologists, psychologists, whoever has worked with data, with big data sets. We are using namely software like R or Python. SAS is a very big issue in our company. And there are 2 different types of how to approach a question. It can be that there's a colleague coming to us and telling us we are planning to launch a new product for people with a chronic heart disease, for example. And we like to know how they go through the system. So that means we are only looking to whole populations. We are not looking to single persons. So we are not doing a profiling in the sense of profiling, from police or whatever. So we are looking to subpopulations and then having a look how they go through the systems and giving insights to our colleagues, thinking about how to shape a product which covers this patient journey through the system. Another approach is that we are looking in a really basic data mining sense to the original layer of unstructured or poorly structured data we have, and using all the algorithms. Everybody in this room knows what to use as. So it's a very hard work to really find points where to find trigger points where to go deeper and deeper, and then sometimes we use text mining. We also have projects where we use pictures, where we use JPEGs, PDFs, and so on to tier information out of these documents.
Mm. Vadym, you're also using the crowd in a sense, because you are based on a community approach, as far as I understood.
True. One of the major and hot topics right now, and even became even hotter than it was, is switch from pay-for-service model to pay-for-performance model. In order actually to pay for performance, you need to measure performance. This is related to what Christoph was saying. Is the patient really get better after visiting a doctor, or is it became worse? And reward should correlate with the results. In particular, for example, for Medicaid or Medicare or whatever else program funded by US government, when they are switching to this model, they have no right tools to do this. They are not ready for it. I think nobody is ready for it. Performance measurement is something which will bring everybody closer. And tools which are used, there are not a lot of variety of those tools. Those are SaaS analytics. Those are some open source alternatives like R, and this is actually it.
So what's the solution? If you said there's nothing available, what's the next trend? I mean, this is.
There are several possible directions for the solution. Recent disruptive technologies, which like a kind of breakthrough in, for example, artificial learning with its deep learning subdirection, may partially solve that problem. Data is there. Healthcare, actually, amount of healthcare data by 2012 will become several exabytes. So it's a perfect data source for deep learning. I think that's it. I would bet on deep learning.
Deep learning, that's a big trend?
Yeah. It became big trend, I think, over the last several years. Before, everybody knows that this Deep Blue won check game. Then Google AlphaGo won something else. And now there is a new algorithm which actually won comparing with previous algorithm, AlphaGo, with a score 100-0. So there is the right time to start to adopt artificial intelligence, and in particular deep learning in the enterprise.
Just as a reminder, if you have any questions, raise your hand. I can hardly see you because the light is kind of weird, but it's also a good time to ask the panelists, for some insights. And I know, I think half of the medical apps are actually counting on insurance companies for a business model. So they count on you to use their data to make sense of the data. And they also see it as a primary, the primary way to monetize. Are you actually accepting data from outside as Techniker Krankenkasse right now?
Oh yeah, it depends on the question, but we are using data from outside, merging them with our own data. And another approach in this direction is that we have just founded a corporation to build up an electronic health record, not a sickness record, not a treatment record, but a health record. So people using this record from next year, they are able to give us the order to put in our data, and then combine this data from Internet of Things, from their fitness trackers. If they go to a pharmacy and buy their own drugs on their own premises, so they can put everything in and can give other companies, can give to the scientific community, but can also say, Techniker Krankenkasse, please roll models on it then to provide me with new products. So we have different approaches using data from other sources, from public sources, but also provide a health record where users can put in their own data and then decide who can use it afterwards.
So it's basically a platform where I, as a patient, as a doctor, can donate my data for the greater good.
And yeah, there's a really new one. It's not a treatment record or a hospital record. It is really a health record. So every health-related data can be put in. And the second is the owner is the patient or the user. He's not necessarily ill. He can also be at good health, but use it in any case. So the owner is this person, and this person can decide who works on this data. So it's a new way of patient-centered healthcare management.
Super interesting. I think also because I know a lot of young companies, startups working on data-driven models that have no access to data to actually validate if the product works or not. So you have open APIs, so some of the data science here could just slip in and grab the data to validate product ideas. Is it something you offer?
No.
So it's for you. You have to say yes or no. Is it open so data scientists that are working on new ideas could actually use the data to validate products?
If the user decides to give his data to scientific study, for example, then he can transfer it from his record to the study, to a university, whatever. If he decides to give it to somebody else, for example, to you, I don't know exactly if it matches well, but in any case, to another company, he can decide so. He can also decide not to give it to give it to us to use. That's his free will, and that's a really new role that is not existing until now, as far as I know.
So did I get you right? You basically give the option to third parties to access once the patient.
We give the option to the user to decide what he's doing with his data.
Okay, all right.
Might be also a great opportunity for you to use that data to validate the services you have in a better way.
Absolutely.
Because we don't believe that the government, the sickness fund, a single company, a single industry company, whatever, should own the data. So the only...
But the insurance company?
No. It's not us who is owning. It's a user who takes the decision.
It's a consent between you and the patient, actually, similar to what you have between doctor and patient.
You find a lot of different solutions in the world. If you go to Switzerland, in Switzerland there's a huge data collection project where people can put all their health data into this data lake, and this lake is by law designed to suit for scientific approaches. So there are really different ways in the world, and we said, okay, we want to offer them a health record, and the decision for what this health data I use is by the user, by the owner, by the patient.
Very interesting. Haven't heard about that before.
I hope it works from next year.
Yeah, I also haven't heard about any other health insurers, pushing that. Is it a joint project by other insurers? I mean, there's a big difference between the private health insurance companies and the public ones. So, I mean, they also have different roles, which is very interesting. Also from a data perspective, also, in terms of collaboration. Is it a joint project?
As far as I know, there's no private health insurance doing this, and as far as I know, there's no other statutory or public health insurance doing it. There's one other, it's AOK. They are offering a fitness record, I would call it. So you can put in a lot of things coming from your wearables, from your trackers and so on.
Would that basically also foster like European law of having a patient traveling, going abroad, using his data wherever he needs it to get treated? Or is that something?
I mean, technically, it's not a problem.
Yeah. The regulations are the problem.
The question is, do we talk about 3 years or 30 years?
Yeah.
Or 20, I don't know.
3 years.
we will see.
I mean, we see that it's working even now. I mean, we're working with insurance companies where people go abroad for a dental treatment. However, it's not that easy as you think. So you basically have to first talk to your insurance company. Your plan has to be approved by the company, or the whole treatment basically, and then you can go abroad and you get it for like the same quality, but maybe a cheaper amount. So the insurance has also an interest in it to of course, save money. And that's why it's, especially for us, also a very interesting topic.
So we have 8 minutes left. I know there are some healthcare companies in the audience. I also know if 50% of the healthcare companies are working with insurance companies to get reimbursement and a business model going, you have to have questions. Especially also if you have Techniker Krankenkasse sitting here, do your sales pitch. I always wonder why you don't use the opportunity to do it. Raise your hand if you have any questions. We have volunteers that can also give you a microphone.
Don't be shy.
What? Don't be shy. Exactly. Otherwise, yeah, there's a question, if I see right.
Hi, in the back. Here? All the way to the back.
Oh yeah, there are 2 questions actually.
So my question is first, with this e-health system that you mentioned, first of all, when is it happening? And also from both the patient and the data scientist perspectives, how would it work? So if I'm a patient, do I just click something and someone has access to my data, or do I need to like go to my doctor, get my data, take that to someone, and then like sign 2 forms that this person can access it, that person can access it? How easy it is? And again, as a data scientist, how can I get access to that data? How easy or hard is it for anyone to get access to that data, given that to the platform basically?
It's a question for you, Torsten.
Yeah, I think the first part of your question was when it is available. If I understood right, it's really loud here, so I did not get your whole question. But the first part was when available. We will launch this product from next year, so it takes some time to get filled by data and so on. And the first step will be to provide scientific community and also other health providers, so doctors, hospitals, with data. What next steps there will be? So private companies, industry, I don't know exactly. So that's quite far away from our thinking from today. But the product will be launched next year. And the second part I did not get exactly. Can you please repeat it?
So as a patient, how do I need to do something to get my data to your servers, or is it all automatic? So if I want to even give consent, is it just a click, or do I need to sign like 20 forms for it?
Okay. You have to consider that there are data which are already in our company, and if the patient likes to have this in his health records, he tells us to transfer them from our database to this health record. Another thing is if he wishes to put in his own data in sense of tracking the devices and so on, then he can put in them directly by the normal technical ways.
And so as a researcher, how can I apply for access to this data or the platform?
It's not this way around. So it's not applying to use this data, but the user can decide who can use this data.
No, I understand that, but I'm saying, so I need to be on the platform as a researcher for the user to give me permission.
It is just, it is only a platform for the users.
But I think what the point is, as soon as the platform is online, you will have to register to get access to the platform. And then, I mean, depending when the platform is online, you will get that kind of information, I guess.
You can use this platform as a citizen, as a patient, but not as a scientific person.
But I thought you're saying you're sharing the data, that the user can give access to universities to use that data, right?
No, he can share the data to them.
But let's talk about that afterwards when Torsten has more options, because we have another question. Stay here, don't move, so we can actually talk about it. Can you also say where you're from, so we get a better understanding who you are.
Okay, so I'm from Czech Republic, so just next to Germany. And I wonder what kind of data do you use in the health insurance company? Because you don't have all the data available in the system, right? So I wonder what exact data do you use for your predictive models?
What data do you use?
What data do you use? I think that's
For example, if you use like number of consumed packages of certain drug, of certain patients, right? So I mean, like this kind of data would use for the predictive models you were talking about.
We use all. I mean, it depends upon the question we are working about. But normally we use all data we have. So every time in Germany a patient sees a doctor, a hospital, goes to pharmacy, have some medical devices, whatever, their data, they're transferred to the health insurances, and the health insurances work on them. So it's
okay. So you have like all the records of the patients, like within your company, within your database, right? Because it's not that common in other countries now.
I think we can talk about this later,
okay.
Because it's quite complicated what there is in our database and what is left in the hospitals and so on. There's a difference between.
I think what you're also aiming for is, and that's something that I think Vadym and also Christoph says, if you have a very mobile workforce and you have one insurance company, let's say in Germany, and the system is very different, the data that is collected from that health insurance company for the kind of German patient is a different one than if I go to the Czech Republic or if I go to another country. How can I access that data and how can I use the data? I think Vadym is also working on that a little bit more in terms of claim management, and Christoph is also very experienced in that, because at the end, if you see Qunomedical, it's best value for money. So I might be insured in Germany, but I use a healthcare service in another part of the world, and it's a different treatment, different data, might be even a better service.
Of course, yeah. Absolutely. Can only agree with you.
Yeah. And also, I mean, we talked about legal requirements, laws, regulation. It's very different from country to country. So the German health insurance companies are also, you know, under pressure in a way, because they are competing with cultures that are more open and more into data sharing than the system in Germany supports. So I think it's amazing that you push forward and say, you know, we collect the data, because not so many people do it.
Yeah, and we will have some more challenges with the GDPR coming up, what we already heard this morning. And so especially for companies like us and companies who treat that much or collect that much sensitive and health data, we have to be absolutely 100% sure that we only save that data that is really necessary and relevant in order to understand and make the process better and give the patient the best option. But also make sure that the way how we process and how we use this data, talking to other companies like insurance companies or analytic companies. So that is another challenge that we're going to face in 2018.
Yeah, I mean, you know, it's a great wrap up. What are the things you see for the next year? And I know, Vadym, there's also a talk coming up on blockchain, and you mentioned that blockchain is definitely something you're working on in the future. What else is there to come for you next year, in the next 12 months? I don't want to hear 30 years. I want to have 12 months, 1 year. You know, what?
Vadym?
Yeah, so next 12 months, so you want me to do a prediction, right? In the next 12 months, I think there should be also disruption in blockchain, because currently it serves very well for some certain things, like mostly financial sector. It's transparency, accountability, and other things related to fintech. But other things like storing massive amount of data on blockchain, for example, how can you do that? So healthcare data being stored on blockchain in a safe, secure way where you can benefit from all that decentralization, immutability, and transparency. This is what should happen, and this is what will happen, I think, over the next 12 months.
For you, Torsten, we know the platform will be one of the biggest projects next year, I guess?
Yeah, but I mean, in our sense, in our analytical sense, it will be going more into image recognition, image analytics. And maybe you have seen, I was posting it recently that we have 2 open posts for people who are really eager to make text mining, image analytics, and so on. So everybody who is interested can ask me. Yeah, we're hiring.
I guess you're also hiring, Christoph, right?
Yeah, definitely.
Growing like crazy, I heard.
Yeah.
On a good way, yeah, definitely. So this is something that is coming up for us for 2018.
So we are going deeper into machine learning and to make our first real projects in deep learning.
Super cool. Thanks again for joining me on stage. If you have any questions, reach out to the 3. Now we have a talk on blockchain. We touched it already. And we also touched trust. We also touched legal reasons in the morning. So I think now we learn more about blockchain and healthcare. Thanks again. And
thank you.
Thank you.
Thanks for listening.
Thanks for preparation.
Yep.
Thank you.